And post-operative eye
I
drops.
normally give gentamicin along with decadron in all the trauma cases.
If it is a traumatic case,
It's very
no
safe.
chance of infection.
It tends to reduce the inflammation. It has no side effects.
Infection.
Not so far. I've not seen.
See, the iris was not open. It was covered by conjunctiva. When we saw your video, so it was well covered with the conjunctiva, though it was protecting away from the sclera. Why you are not reposited? That is what I am asking.
It was not getting
You removed the.
in the second case where the lens was coming out. That's the case you're talking about.
And you removed the conjunctiva.
Yes, I removed the conjunctiva.
Then iris was.
Yes, it was covered under the conjunctiva, but it was
I
not
think there
going.
was hardly any chance of infection
Yes, but
because
it
it was
was
well covered.
But it was not going back. So I've just excised a very small amount of iris.
And one more last thing. In all the scleral injuries after suturing, you have to refer to the patient to the retinal surgeon, examine the posterior segment. You should not forget it.
Yeah, we always do that. We have an in-house vitreoretinal surgeon with us in our
Thank
institute.
you, Dr. Sanjeev. They'll keep on grilling you otherwise. Thank you for a wonderful talk. D.K. Mehta. Madam, action repeat. He's going to talk to us on protective devices in sports trauma.
I'm going to talk to you about the protective devices in sports trauma. I know this topic may not interest us because we all want to do the surgery. Otherwise, if you have the protection, you will have no surgeries. So probably, keeping that in mind, I'll just give you some of the thoughts. A 29-year-old myopic man sustained 2 separate giant tears in his right eye following deliberate eye gouging during a rugby tackle. India's hockey goalkeeper Baljit Singh underwent an emergency surgery on Saturday after suffering a serious injury while training with a golf ball in the national camp. This man was not wearing his protective device and he was practicing. Again, this is a thing, a rugby player, a top rugby player got blinded by the horror injury. You can see most of the time rugby is not using any protective gears. This is the picture of India's goalie. And the outcome of this Baljit Singh's surgery, he was operated in All India Institute, he was operated later in Shankar Netralaya and re-operated back in institute, and finally they have said the eye is lost. And this was all because he was not wearing the protective gears at that time, and we lost a useful player of the international repute. In America also, we have lot of injuries due to sports. These are the figures. I'm not going to talk about it more. Younger people are affected more, and they give you an exchequer on the economics, on the man hours lost, on the national economy loss at the total end. If you see, world over more than 50% cases are under 25. Average age in India also is 25. All injuries of admissions below 14 years are injuries due to sports, and similar figures are there all over. Sports injuries that are caused could be because of the non-contact games, cross-country and these things, contact, ball, baseball, wrestling, soccer, collision, football, hockey, rugby and lacrosse, and many others. However, the injuries by different sport may not be taken as injurious or simple or non-serious due to a particular game. The low risk, high risk and very high risk is divided as sport-wise, but unfortunately it doesn't hold true most of the time. These are the factor of the damage that is causing the eye damage, the speed of the object or the missile it hits with, the size, like a cricket ball is less dangerous than a golf ball because it can hit the right onto the eye straight rather than a tennis ball or a cricket ball. And the impact it goes with, maybe a shuttlecock is having a speed of almost 80 miles when it hits you. So that is a small object, but it may hit you so hard and lose your sight. The adnexal injuries are more common during multi-trauma. football, baseball, rugby, etc. are causing more damage to the orbit than the globe. Anterior segment alone is involved in 40 to 48% of the sports injuries, and posterior segment involvement is seen in 30 to 40%, while posterior segment alone is involved in about 11% of the closed trauma. And then if we talk about what is the risk involved, there are 4 basic types of the eye wear. Only 2 are protective as far as the glasses are concerned. The safety sport wear that conforms to the requirements of the American Society of Testing Material, and the standards are given to this. And the second is sports wear that are attached to a helmet. These are the main protective gears which you use while using in different sports. I'll go one by one. The glasses that are supposed to be protective, yes. Ordinary sunglasses have no protection. Swimming glasses for swimming purposes, yes, it can be used, and they have to be specific. Polaroid glasses for you can say snow games or high altitude ones. UV glasses could be used for certain areas like when you are talking about skiing. The sport goggles are again decided onto a specific game that is being played, and question of prescription glasses comes when an athlete comes to you. He says, I am playing the game, I am wearing a glass of -9. What do I do? So probably that is where we would like to talk about that. And these are the various glasses which are available as the protective glasses, where one is the area is more, second is it is giving you a wider field, and side wrap is there, and the safety onto the side is there from the side injuries. This is another one. Commonly we talk about the protection to the eye during sports, particularly the children. They are wearing glasses, and the mother very nicely tells, don't wear glasses when you are going out to play. Or you are always scared that a glass may hit the globe and cause the damage. Polycarbonate glasses are really very good, but unfortunately the best part is even the ophthalmologists are not prescribing it. A figure 4 out of 10 opticians are only thinking that this is meant for children's glasses, and others are using this very extensively, where they are using it for rimless glasses. Because it is strong and that is the end of it, they are all using polycarbonate glasses, but they are not recommending it for sports injuries for children who can be more prone for it. Now, what are the qualities of this polycarbonate glasses or the lens? 8 times it is stronger, and it is 25 to 50% lighter. It is shatterproof, can be made thinner up to 0.4 mm. However, the safety standards say a safety gear, particularly needing this kind of a glass, should be minimum 3 millimeter thickness. These are the polycarbonate goggles, 3 millimeter thickness of the lenses for all high speed and ball games. Glasses for cricket. Cricket we all love, play, dream. And that is what certain glasses are there. Polycarbonate lenses with side covered. However, nylon or polycarbonate frames are also available so for the extra strength. And similar ones may be there. For the contact lens wearers, what do we have special? Protective glasses are a must. Handy storage kits must be kept, and prescription glasses as a standby should be there for an athlete, for a sportsman who is using contact lens. And avoidance of contact lens is desirable in high-speed games. Post-RK and post-LASIK eyes, protective shield, visors, polycarbonate glasses are very important, and collision sports are no for them. Swimming glasses and water games, again RK should be avoiding it, and the LASIK eyes also should not be having so much of indulgence into it for various reasons, particularly when you are diving. These are the masks available which you can use over the spectacles. One with the, you can see with a headband, and the racket game is being effectively played on them. There is no fogging, eliminates the disadvantage of fogging, hazing, and nose discomfort and restricted peripheral vision. And similarly, they can be worn over the glasses, and supporting them with the impact of the lenses also can be saved. These are different visors available. Swimming goggles, we all know more about it, and maybe we prescribe them because there are very few swimmers coming to you for a medical advice of this kind. This is a headgear for baseball. Again, very strong, very aggressive kind of a game we must treat. Cycling, having the kind of the goggles which is wide angle, good area, and fitting well onto the face. And these are the skiing and snow surfing goggles. Now basically what we know that some sports have got the standardized items, or for that purpose different games have been there. In India we do not have much of the standardization. Some standardization agencies are there in America, Canada, New Zealand, and UK as well. And they have standardized the gears for these games and given them the catalog numbers. Certification for the game, sports material, protective gears, host-related, agent-related, and environmental related things are also important, and somehow the area and the restricted area must be covered. Other protectors with a similar kind of a thing are there, and these are some of the catalog numbers which I am giving, which have been standardized for different games. And for as